Hello, this is a community assessment for SPC's Community Health Nursing of Pinellas Park, Florida, presented by Sarah Burton and Amber Lavallee. Located in Pinellas County, Pinellas Park was initially purchased as acreage lots by noted medical publisher Frank Allen Davis. Pinellas Park was initially settled in 1911 as Pinellas Farms by a conglomerate known as the Florida Association, gaining township status in 1914. Due to the advances of the Tampa and Gulf Coast Railroad, by 1923 Pinellas Park was considered the crossroads of Pinellas County. Settlers were encouraged to plant citrus trees and sugarcane for quick growth and foolproof profit. Citizens of northern states were encouraged to pack up and move to the fresher air of Pinellas Park. Based on information gathered during a community assessment, Pinellas Park offers many housing solutions for most budgets, although the average price of a two-bedroom rental in Pinellas Park is $1,300, a price that is significantly higher than most of the surrounding areas, neighborhoods, and towns. Single-family homes, duplexes, and mobile homes are available for leasing or for purchase throughout the city at a variety of prices. The conditions of these homes vary greatly. The city also offers 8 low-income complexes that allow for sliding scale rental or government voucher use via Section 8 of the Housing Authority. Several of these are designated specifically for seniors or for the disabled. These facilities typically have a very long wait list for availability. With such a wide range of residential dwellings, there is adequate housing for all budgets and lifestyles. However, Pinellas Park is not home to any freestanding homeless shelters. There are several halfway houses, transitional housing, and sober houses within city limits that help to provide for the homeless and the mentally ill, as well as emergency shelters during harsh environmental concerns. Based on the community assessment, Pinellas Park meets the needs of the community well. Pinellas Park is home to over 60 religious groups and places of worship, including Christian, Muslim, Hindu, and Buddhist. Transportation is abundant. While the majority of Pinellas Park residents utilize private vehicles, public transportation such as buses and ride-sharing are prevalent and low in cost. Entertainment and recreation events are numerous, with parks, trails, festivals, and fairs, in addition to outdoor fun such as horseback riding or canoeing. Community services such as schools and library services are top-notch, as well as Pinellas Park's standalone fire and police services. According to the latest census, the population of Pinellas Park is over 49,000, with a population growth of 3,400 within the last 10 years. Due to the sunny climate, Pinellas Park is home to many seasonal residents as well, with an estimated influx of 58,000 annually. The average Pinellas Park resident is white, employed, and considered middle class. Major health concerns for the residents of Pinellas Park include communicable diseases such as hepatitis and STDs, heart disease, cancer, and obesity. These will be discussed later on. Resources are widely available for the citizens of Pinellas Park, with close access to food, clothing, and medical care for most every budget and lifestyle. A new freestanding ER recently opened up for the people of Pinellas Park, as well as numerous ambulatory and walk-in care clinics. Most facilities accept major insurances, and some provide sliding scale or low-cost fees. For those requiring a higher level of care, adult daycares, home health agencies, skilled nursing, and assisted living facilities are available. While insurance can assist with costs, often out-of-pocket fees are required. Average cost in Pinellas Park is over $100,000 annually. There is a huge variety of supermarket availability in Pinellas Park. These range from specialty and ethnic stores to farmers markets to general supermarkets to discount suppliers. Food purchases are available to all budgets. Numerous food banks are available to help those in need, but may only be available at certain times. Some limitations of local food pantries include reduced hours of giving, income requirements, and of course availability of food donations. Some pantries only give out food one day a month, some only give out to people who can provide proof of low income, and some pantries require referral to receive services. Most organizations that assist with these services are located in St. Pete or Clearwater.
After analyzing the information gathered during the community assessment, the top community objective for the city of Pinellas Park is improving heart health. At 21.5%, heart disease is the leading cause of death in this community. Being an urban area with 13.2% of the community below the poverty line, fast food areas are prevalent. Pinellas County has more smokers and alcoholics than the state average. The second being improving health and quality of life of older adults. 20.5% of Pinellas Park is 65 years and older. Education and preventative services can reduce health issues and associated healthcare costs. And the last, improving social determinants of health. There's not always availability for clothing and toiletries for those in need within Pinellas Park. 1.5% of the community is receiving public assistance. Based on the findings of the community assessment, Pinellas Park appears to have adequate environmental resources. Sanitation services are provided by the city, utilizing water purchased from Pinellas County. Waste management and sewage control are adequately maintained by the Pinellas Park Public Works Department, with timely waste pickups 2 times per week, as well as curbside recycling services. In addition to potable water, the city also provides access to reclaimed water, which can be used for irrigation purposes at a low cost. Outdoor air quality control is monitored by Pinellas County, with daily readings frequently updated on the Pinellas County website or via a recorded line. Vector control is monitored and provided by Pinellas County on a routine basis by ground and air, with a focus on preventative treatment of mosquito reduction. This is particularly important in Pinellas County due to numerous canals and areas of standing water. Increasing amounts of polluted air come from ever-elevating lead levels from car exhaust, which is ever-present. With the increase of people comes the increase of littering, and Pinellas Park is no different from many big cities in that way. This means a change in the ecosystem of the city. With an increase in urbanization, there is a decrease in animal and plant populations and ecosystems. There are less places for animals to live and hide, and more deadly things to animals all around, including toxins, litter, busy roads, and people feeding them human food. There are also less plant varieties out of necessity for more growth of the urban environment. Climate change has increased the severity of hurricanes, made floods all the more intense and frequent, and increased rains in the rainier areas, which would be all of Florida. This also increases the risks of environmental allergic reactions for people as well. And though that is not as big a threat as a hurricane, it is still a concern. The increase of the wet climate has also lengthened mosquito season. Sandra Bradbury holds the office of Mayor of Pinellas Park, which is an elected position. Ms. Bradbury runs alongside a vice mayor, elected council members, and other appointed staff. City council meetings are held every Thursday at 6 p.m. and are open to the public. Meeting objectives and discussions are available for review of the Pinellas Park website. The budget for the city is overseen by the Office of Management and Budget and is available to all on the City of Pinellas Park website. No obvious oversights nor egregious spending practices are noted. Along with the mayor, these 4 council members also make up an agency known as the Community Redevelopment Agency, or the CRA, whose purpose is to regenerate the area physically by helping preserve historic landmarks, sustaining affordable housing, and redeveloping places that need it. While the CRA is made up of city council members, the CRA acts as a separate entity under the leadership of the deputy city mayor. While no issues are currently noted, actions of the CRA may result as a governmental conflict of interest. 6 noted community needs are primary prevention methods and teaching. Primary prevention and teaching is also necessary to prevent the common issues below. With teaching and issues, they wouldn't be so prevalent, and while some of these issues have non-modifiable components, lowering the rate of these illnesses is the top tier issue. Heart disease. Nationwide, heart disease is the #1 cause of death. Higher incidence of heart disease are directly related to modifiable risk factors such as obesity and substance abuse. Use of community nurses and public health education on modifiable risk factors has shown to have a positive effect on heart health. Since there is a high rate of heart disease in Pinellas Park, this needs to be a focus and is therefore #2 on the list. Obesity. With the amount of fast food restaurants in this bustling urban city, there are many psychosocial and physical issues that come into play. Psychosocially, obese people have an increased risk of depression. They also have an increased risk of medical illnesses such as heart disease and diabetes. For alcoholism and tobacco, there are many more alcoholics and tobacco users in Pinellas Park than the state average. These can affect a person not just medically, but sociologically, financially, and it can harm others when one is under the influence of alcohol or tobacco. secondhand smoke and kill people. And every day in the U.S., people die from automobile accidents involving drunk driving. For STDs, they are the leading cause of communicable diseases in the county. Consistency in treating and discussing these diseases can help protect the whole community. And as for poverty, 13.2% of people in Pinellas Park are under the poverty level, and this affects many things besides financial issues, like the ability to prevent diseases with primary care, transportation issues, and in other areas. Community health nursing can help to bridge this gap. In Pinellas County, we are fortunate to be able to access the Florida Assertive Community treatment programs. The FACT team visits patients in the community to help with medication compliance and medical and psychiatric follow-up. Studies have shown that healthcare workers in the community lead to better patient outcomes.